Do you have a few $100,000 saved up to pay for healthcare costs in retirement? According to a recent study by Jackson National, nearly 2/3 of pre-retirees severely underestimated the cost of healthcare in retirement. Hey everyone, Gabe Galante here, fiduciary financial advisor, owner and CEO of Rockline Wealth Management. Over the last 12 years, I've had the opportunity to work with hundreds of families on their retirement and financial planning. And today, I'm going to walk you through 5 critical pillars surrounding Medicare and long-term care planning to help you prepare for what could be one of the most expensive pieces of your retirement plan. And be sure to stick around to the end, where I'm going to go over what I would consider to be the most overlooked component of medical care costs in retirement. The first critical pillar I want to demystify for you today are the different parts of Medicare and how they might apply to you. For those of you not aware, Medicare consists of 4 parts. Part A, which is hospital insurance, covers inpatient care in hospitals, care in skilled nursing facilities, hospice care, and home health care. Part B, which is medical insurance, and covers things like doctors and healthcare providers, outpatient care, durable healthcare and medical equipment, and preventative services like shots and vaccines. Part C, also known as Medicare Advantage, is an alternative to Parts A and B, and can include bundled services such as vision, hearing, and dental. And Part D, which is drug coverage. And just like the name says, it can help cover costs associated with prescriptions. Now that we have an overview of the different pillars of Medicare, it's time to talk about how you might get signed up versus your initial enrollment period. Typically, one's initial enrollment period includes the 3 months prior to turning 65, the month in which you turn 65, and the 3 months after you turn 65. With that said, if you're receiving Social Security due to disability or retirement, you'll automatically be signed up for Parts A and Part B when you become eligible. If you don't fall into that category, you'll need to apply yourself in order to complete your enrollment. Once you enroll in Part A and Part B, you can explore the additional pieces to the puzzle, which include Part C and Part D. The third critical pillar of Medicare long-term care planning is understanding what your options are if you're continuing to work past the age of 65. Before I hop into that, please do remember, regardless of if you're working or not, you will still have that 7-month window for your initial enrollment period. Now, depending on your employer's coverage, you may be able to delay that enrollment without facing penalties. In order to figure this out, I would suggest speaking with your benefits manager to further understand if your employer's coverage is creditable or not. This means that your coverage through your employer is at least as good as the coverage provided by Medicare. If so, this could be an instance where you may be able to delay enrollment and not face penalties when enrolling at a later date. In order to qualify, you would need to enroll within 8 months of losing your or your spouse's coverage in the workplace or stopping work altogether. The fourth critical pillar of Medicare long-term care planning is understanding the costs associated. If you want to gain a more concrete idea of what your long-term care needs could be, please feel free to check out the calculator we've provided in the description below. Although in many cases, there are no premiums associated with Medicare Part A, there could be deductibles associated with hospital visits and copays associated with inpatient stays. In order to understand who falls into the category of not having to pay for Medicare Part A, it typically includes individuals who have worked for a period of time and paid Medicare taxes, with that window being about 10 years. With Medicare Part B, there is a premium associated with coverage, and that premium can increase on an annual basis depending on your income. In addition, there's a deductible associated with Medicare Part B, and there could be additional costs for other services. With Medicare Part D, for your drug coverage, there are premiums associated. In addition, if you choose to go the route of a Medicare Advantage plan, there are monthly premiums associated with that as well. The next critical pillar of healthcare and retirement is the one in which I feel is most often overlooked. Along with our advancement in society and innovations continuing to accelerate, we're seeing the average life expectancy of us as humans continue to grow over time. And with that growth comes the need for long-term care, among other things. Although there's a wide variety of types of long-term care, ranging from in-home care to skilled nursing facilities, we've commonly seen these costs range somewhere from thousands of dollars a month to tens of thousands of dollars a month on the high end. Planning for these types of costs earlier in life can help you with that burden down the road. Proactive steps such as saving in a health savings account, buying a long-term care policy, or even working with an estate attorney and Medicaid planning are all steps to consider for this. If you want to be proactive but you don't know where to start, feel free to check out our next video on retirement readiness here.